for coming. I'm Katie Combs Pritchard. I'm due public information for Placer County Health and Human Services, including our public health division. Today, as you may have heard, we have an update on novel coronavirus here in Placer County. So I'm going to bring up our health officer, Dr. Amy Sisson, and she'll make a brief statement before we open it up for questions. So, Amy?
Thank you, Katie. Last night, we were notified that a resident of Placer County is confirmed to have tested presumptively positive for the novel coronavirus, pending final confirmation from the Centers for Disease Control and Prevention. This individual is a North Bay Vaca Valley Hospital healthcare worker who had close contact with a confirmed case in Solano County. The Placer County individual is currently isolated at home with mild symptoms. We're in the process of identifying and evaluating close contacts of this individual in partnership with our counterparts in Solano County. We have expected to see cases of COVID-19 in Placer County and have been planning and preparing accordingly. The immediate risk to the general public in our community is currently relatively low, but given recent evidence of community spread occurring elsewhere in California, we're now encouraging the public to prepare for the likelihood of community spread here as well. I want to be clear that this case does not represent local community transmission. This case is a healthcare worker with close contact to a confirmed case. The case announced today underscores that healthcare workers are often on the front lines when it comes to battling infectious diseases like COVID-19. But by taking some simple steps to prepare you and your family, every person can also do their part to help stop the spread of this disease in our community. Placer County residents, workers, and visitors should always practice good hygiene, such as washing your hands with soap and water or using hand sanitizer. Avoid touching your face with unwashed hands. When coughing or sneezing, cover your mouth and nose with a tissue or use your sleeve, and stay home when you're sick. These simple steps will go a long way toward preventing the spread of disease. Face masks are not recommended for use by members of the general public who are well, but can be worn by people who are sick to stop the spread of germs. We're also asking residents to think through how prepared they are to handle potential disruption to daily life that could result from school and childcare facility closures, event cancellations, and other safety measures that we might consider in the event of widespread transmission of COVID-19. Make sure you have 2 weeks of food, medications, and other necessities on hand in the event you are asked to quarantine. To be very clear, we see no need to implement these measures currently, and the immediate risk to our residents posed by COVID-19 is relatively low at this time. But as we prepare for possibilities in this rapidly evolving situation, we encourage our residents to start having planning conversations. We appreciate the ongoing support and resources from both the Centers for Disease Control and Prevention, as well as the California Department of Public Health, Solano County Public Health, and other county and regional partners. We will continue to provide updates when we receive important information. We appreciate your attention on this issue.
So Dr. Sisson will now take questions, and I'm also going to bring up Michael Romero, our Emergency Preparedness Coordinator.
The patient commuted to work, is that right? They lived here but worked there?
That's correct. The case lives in Placer County and works in Solano County.
What do we know about the how the person who that healthcare worker was in contact with, how they got coronavirus? Was that community spread, or do you know that?
So the healthcare worker was exposed to the Solano County case, who is currently being treated at UC Davis Medical Center. So that is the initial case who exposed our healthcare worker did acquire the infection through community transmission.
So it took about a whole week before that, this case was identified. Do we know that this healthcare worker was placed in isolation been identified, you said last time?
Yes, the healthcare worker was already in isolation while we were awaiting the test results.
Do we know if there are other healthcare workers that have also been placed in isolation?
Solano County could comment more on that, but there are additional healthcare workers who are in isolation. And there, as you know from yesterday's reports, there were 2 additional healthcare workers in Alameda and Solano County who tested positive from exposures to the same case in Solano County.
Can you talk about the symptoms? Were they mild? Were they severe?
This case has mild symptoms, has not required hospitalization, and is isolating at home.
And you're pretty sure they just went to and from work and home? Didn't stop anywhere else?
That is correct.
What kind of measures are these people taking at home? As far as I know that they're remaining in isolation, but are they getting usually like visits or consultations from nurses?
At this point, the patient is in isolation with only household members who are also being quarantined. But there are no other people coming and going from the home. We will have public health nurses visiting to do testing, but we aren't at that stage in the process yet.
Can you take us through the timeline? When you suspected, you asked the CDC to do an official test. Can you...
Barry here. Sorry. Sorry about that.
Right.
No worries. The timeline on when you asked for the test and when it was given, was there any time delay?
Right. So the question is, was there any time delay in requesting the test? No. I want to thank our partners in Sacramento County at the Public Health Lab. They were tremendous partners throughout this process. We've requested testing and were able to get it immediately. I would say that the entire process went very quickly and smoothly.
Have any of the other family members that are also in isolation showed any symptoms, and can it be expected that they may be showing symptoms, since they're in the same home?
Right. So the question is whether any of this case's family members are showing symptoms. All close contacts are asymptomatic at this time.
Can we say how many family members there are?
I cannot say.
And probably can't say this either, but I'll ask. You said a healthcare employee or worker. Can you say nurse, doctor, janitor, anything like that?
No, I don't feel comfortable sharing that information. We want to make sure we protect the confidentiality of the case.
Can you give us an age group range? Or?
I can say that it is an adult.
How long have they been working at the hospital?
I cannot comment on that.
Male, female?
Sorry, I cannot comment on that.
What are some of the measures, maybe you can't speak to that hospital, but here in this county, some of the measures that healthcare workers who would be in contact with people who have it or possibly have it, what kind of measures do they take to protect themselves? Is it just what we're hearing, for ourselves, making sure we wash our hands, et cetera?
Right, so the question is, what measures are healthcare workers taking to protect themselves from COVID-19 exposure? There is a great amount of guidance coming from the Centers for Disease Control about the personal protective equipment, or PPE, that's suggested for healthcare workers in the setting of somebody who's a suspected case of COVID-19. So that includes standard precautions, as well as contact precautions and respiratory precautions, as well as eye protection. So what that ends up being is a gown, gloves, an N95 respirator, as well as eye protection.
For the other family members who are in quarantine with that person, are they wearing that stuff then? How does that work for them to try to protect themselves?
Yes, the question is, the family members who are in quarantine, what protective measures are they taking? The quarantined individuals will be separated from the case under isolation to minimize exposure.
Do you expect to see more
Yeah, so the question is whether we expect to see more cases because testing is becoming more widely available. We definitely expect to see more cases, and I do think that the wider availability of testing as well as the expansion of the case definition by the CDC to include people without a travel history or without close contact to a confirmed case, expanding it to individuals who are hospitalized and do not have another explanation for their illness will allow us to test more people, and we will also be able to test those people more quickly because we are now able to test here in California, including at the Sacramento Public Health Lab. So we'll be able to get test results within 48 hours. In this case, we got test results within 24, yeah, within 12 hours, so it was very quick. But yes, I do think that we will be seeing more cases. I do want to clarify, I do not think that we're going to see more cases as a result of this specific case. This is not community transmission, but I do think that we will eventually be seeing cases that represent community transmission. Yes?
Contagious and not symptomatic?
The question is whether somebody can be contagious and not symptomatic. COVID-19 and the virus that causes it, SARS-CoV-2, is new. There's a lot that we're still learning about it. That is something that has been reported in the literature. It's not thought to be a main driver of the epidemic, at least in China, but there have been some reports of asymptomatic transmission, and so I think that is partly why we are being cautious with our quarantine measures in this case and in other cases of other confirmed cases.